All right, let's talk about what healthy enough for surgery means, because it can really vary by surgeon. So everything I do is purely elective and purely cosmetic. So I have a very high bar on healthy enough for surgery because none of it's medically necessary, and I sure don't want to increase risk of harm, for something that's not affecting life or function. So in general, if you have diabetes, I want your hemoglobin A1C at 7 or less. Your blood pressure needs to be moderately well controlled, systolic of 160 or less, which actually isn't that tight of control in terms of stroke or heart attack risk, but it's enough for surgery in terms of bleeding risk. If you are on aspirin, Plavix, or any other blood thinners, you need to be able to stop those for 5 days to a week ahead of surgery, depending on which ones they are. Some patients are on aspirin and Plavix and they cannot come off the aspirin because they've got a drug-eluting stent that's at risk of clotting off. So in that case, you are not a candidate for most operations I perform. There are some exceptions, like I'll do upper eye lift even on people on blood thinners because it's such a minimal surgery, but for most things, if you're on blood thinners, it's a no-go. If you have any pulmonary issues where you regularly see a pulmonologist or any cardiac issues where you regularly see a cardiologist, we would want clearance for those issues from those physicians. Blood pressure medications in and of themselves aren't a problem as long as your blood pressure is fairly well controlled. The other thing I look at is immune modulators and steroids. So if you're on medications for things like lupus or Sjogren's or IBS or Crohn's and you're on immune suppressants, those can affect healing and increase the risk of infection. So some of those medications we do need to hold before surgery. Those are kind of the big ones. Otherwise, if you're out there living your life and seeing your physician regularly, we're usually good.